can you tell me about your expectations once you found out you were pregnant?
Well, the expectation was perfect, healthy, hopefully no problems. We did go through IVF, so it was completely planned, and we almost felt like we got to choose the embryo because there were 4 ready, and hers looked good, so she was implanted, and seemed like everything was going fine. I did have one little bit of an issue. I think when I was about 8 weeks along, I had some hemorrhaging or some bleeding, but everything was found to be normal. She was perfectly fine, even though that happened. So everything else kind of proceeded normally for the most part. As I grew larger, though, the other thing that kind of was a little bit strange during the pregnancy was my right side would ache. And I didn't know if it had to do with some scar tissue from previous surgery that I'd had or something like that. But it was consistent. As she got bigger in there and she would turn a certain way, it was quite painful. And I don't know if that had anything whatsoever to do with the torticollis or her coming out with that, but really still no other issues with pregnancy. Normal ultrasounds, blood tests, everything came out completely normal. They did do some preliminary chromosomal tests, normal, nothing seemed to have a flag, but and then delivery, we were induced. She was full term at 39 weeks and 4 days. So we went through the induction and took a little bit longer than expected considering she was my second child for me to get dilated and everything, but still fairly easy and run-of-the-mill. Nothing too crazy. She was born and appeared to really be in excellent shape. Lung development, there were no problems with her color, her APGAR scores, everything was great. Up until she had her first infant hearing screening.
Okay.
And
when was that?
That was the day she was born, I believe.
Okay.
And so they said that she received a response from the machine of referred, which meant that they needed to repeat it. So I believe it was like maybe the next day they came in and repeated it, and it ended with the same result, referred. So that was our first indication that anything could possibly be going on with her. Oh, I guess in addition to, she was having problems latching on. I was attempting to breastfeed, and she just couldn't really latch on, and it really, we started to notice that her mouth was small, and also that when she cried there was a little asymmetry to her cry on her face. So along with the hearing test, that was like another indication that something maybe was not quite right. So she went in for an ABR, and it
When
came.
was that? 2-3 weeks?
No, it was at the hospital.
At the hospital.
Yeah, it was at the hospital, so it might have been maybe even the next day. And it did indicate that she was severely hearing impaired in one ear, and that she also had some hearing impairment in the other ear. I think that was probably the most emotional time for Bob and I at the hospital, because it just kind of scared the heck out of us. We had never really expected to have a child with any kind of disability, and we just didn't know what to think, what to feel. We were really kind of confused, and also just, I think, very nervous for her. You know, growing up, what would it mean? What, you know, would she be completely deaf? We just didn't know. So it was kind of an emotional and scary time there. And then the next sort of thing happened at the hospital. Cardiologists.
You were still in the hospital during that time.
Right. All this kind of was starting to, it was all unfolding at the hospital as far as the preliminary things. And then they were checking her heart, and the pediatrician there in the hospital, they did what they normally do as far as sending her to, I believe, the pediatric cardiologist who may have been there. And she had like a murmur, which I guess is normal for newborns. But something with hers, I mean, and now that it's, she's 5.5 months, it's hard for me to remember exactly, but they did feel that she could possibly have a aortic arch that goes in the opposite direction. So by the time we left the hospital, there were 3 things that sort of threw up flags for us. The hearing, the asymmetry, and trouble with her feeding, and then also the heart. She stayed 1 extra night just because they wanted to make sure she was eating okay, and she was, so we got discharged to come home. And they really just wanted us to make sure that we followed up with our pediatrician pretty much like the next day. So we went into the pediatrician, and it was like another indicator popped up. They look into children's eyes with the red light, and retinas are supposed to shine a red light back. Well, with Ryan, there was no red light shining back, so she wanted us to go see a pediatric ophthalmologist immediately, which we pretty much did. I think it might have been the next day. And that's when we found out that she had colobomas in both eyes, which are also indicators for charge syndrome. And really, that was the first person or first specialist who wrote out in his report that he thought that she could actually potentially have charge syndrome. So,
How are you dealing with all this?
it was scary, stressful. I think one of the challenges that we had to really deal with, and her thriving and making sure that she was doing what she was supposed to do, is making sure that she was eating and being fed. So that was the scariest part of it. Was she eating enough? Was she going to be able to eat? Would she end up being hospitalized because we couldn't feed her, or she wasn't growing, or was she going to be blind? That was almost a new thing. We knew she had the hearing things, but then, adding on to would she even see? We felt like she was seeing something, though, even as a newborn. So we kind of just had to hold on to some kind of faith, and, is she going to, be able to do some things? She'll be able to do some things. It won't just be no sight, no hearing. And really, we just kind of did a day at a time and continued to just try to feed her. And
Now, how
that
much
became
did she
important.
weigh when she was born?
She was 6 pounds, 1 ounce.
Okay, was she losing weight, or was she still just maintaining weight?
She maybe lost 4 or 5 ounces, but she picked it right back up.
Oh, that's good.
Her percentiles were low, like she was between the 7th and 8th percentile most of the time at the very beginning, but she's consistently gained, and now her last appointment she was at the 17th percentile, so she's just gotten better and better. She's proven to us that she's strong and willing to grow and thrive.
Alrighty, so did you feel different? I mean, did it just impact you more each time that you got another diagnosis? I mean, did you feel like it was just like, is it going to end? I mean, what else?
And it did. I mean, it did feel like it was just, piling on.
Right.
Just piling on. What else could possibly go wrong? And with each test, we just would hope, really, for the best. And I think, we really had our spirits lifted when we had to go in for an ultrasound for her kidneys to be checked.
Right.
And just not knowing, is this going to be yet another thing that is going to be wrong?
Right.
And thankfully, she had both kidneys proper size, they were functioning properly, so that was something that we didn't have to deal with. But still, there's no end to what may come next. We don't know yet if she has a vascular ring based upon her aortic arch going in the opposite direction. It was confirmed, like we were hoping and that maybe it really wasn't going the wrong way, but we finally did get the confirmation from when they did her echo on April 18th that it does actually go in the opposite direction. What that means for her, we don't know, and that's where
The unknown.
the unknown. Yeah, that's the scary part, and it could be piling on still, is what the point I'm making here, because we don't know. Could the vascular ring cause her a problem, and she have to have surgery to repair it, or will she be completely fine, no problems? Athletically sound, and you wouldn't be able to tell the difference. We just don't know.
Right. Now, have you had to make any adaptations because of her vision and her hearing loss? I mean, what do you see Ryan doing now, today?
Well, I think she's definitely using her environment to her advantage. She's doing a great job of, even though she has these setbacks, with maybe some hearing loss or vision loss in the one eye, she is happy, healthy. She's a joy to be around. She's just, to me, like any other baby, she's got this personality. Her being a redhead, I don't want to offend any redheads. She's quite fiery, and she knows what she wants.
Right.
She's definitely got this personality, and she's determined.
Right.
And she loves to learn and enjoys really interactions with people, things, and I see her doing whatever she wants to do, even amidst, what she's going through.
Right. And just talk really briefly about what therapies are you in now?
Well, right now we are doing speech therapy with Babies Can't Wait. It's wonderful. Just the fact that they come in home is very nice for us. We have plenty of appointments outside the home, and it's nice to have the comfort of her home and learning to interact with her here at home has just really been beneficial. The same thing with her physical therapy. We have a physical therapist through Babies Can't Wait that comes in to the home and helps us to utilize the things in her environment in order to help with her therapy. Yeah. And so that's just been really good too, because we're learning to just be at home and help her with her physical and her speech needs. So.
And then you've got Georgia Pines, of course, too, which comes in the home, which is me. And that also helps as far as, the vision and the hearing piece.
Parent focus, there's so much.
Yeah, I know. I know, that's what
I'm
parents
sorry.
need to know.
You're Georgia Pines.
Yeah, but there's so many other agencies too that you're probably connected to as well. So, what would you say, what did the doctors tell you about her prognosis as far as with all these different doctors? Did they give you any kind of, did they have the crystal ball to say what she's going to be like, or did they just say, let's wait and see and just do the stimulation and things?
Well, it just certainly seems like a wait and see, and I don't know if that's just, they don't want to get a parent's hopes up to, things are going to be better than they are. With the ophthalmologist, he doesn't want to get our hopes up that anything's going to be better than it is. I mean, the continued response is kind of waiting till she's of age and that she can interact and tell us what she's seeing and what she's hearing, and kind of just waiting.
How has Ryan changed you or your family?
Well, I think having a baby changes things plenty in and of itself, but having a child that needs extras, it's definitely something that requires time management. It requires patience. I think having an open mind, willingness to rely on resources and other people, because there's just so much you don't know when you're dealing with just special needs, and especially with her just not knowing if she's going to have the heart thing, if she's going to be able to see, what she's going to be able to hear exactly. And then now to, just the new things. And you have to kind of take things and learn how to do it. And of course the latest is hearing aids. We're just so thrilled that she has hearing aids, and she's just doing great with them. But that was quite a challenge last week, getting them to stay in, and
Feedback.
hearing them. There's just a lot involved with hearing aids that you just wouldn't really expect, I think, as a parent.
Right.
So learning everything has been quite a challenge. I mean, machines in the home. At one point, they did want us to monitor her eating on a pulse ox machine.
Right.
So just different things that we would never normally have thought of having to deal with, medical suppliers, and really learning what a deductible is, and just all this stuff that, you just, with it, when you have a healthy child, just kind of, you don't really think about it.
Right.
And it's added a ton more work. And a lot more stress than would have expected. So, and it's been hard. I mean, to be honest, I never said I was a pro mom, with my first one, and it's been quite a challenge to kind of just get used to everything, and I love me time, and there's not as much me time as I'd like with this one. So it's been quite a challenge, and by the grace of God, I'm just making it through.
You mentioned time management. How many appointments do you or people do you see per week that you normally would not have done? So you were just saying, like, doctor's appointments, and because I know it's your schedule's very tight a lot of times, given
At least 4 appointments each week, I would say, between physical therapy and speech therapy, and going in for maybe hearing aids, her going in for a checkup for the ear, nose, and throat. Her even going in for a well child visit. We got to add those in too. Right. She's got shots and things that she needs to do.
Right.
But follow-up appointments with the geneticist and with the ophthalmologist. And there's just things that she's got to do. And she's gone through a surgery, so next thing, this week, besides, the 2 other appointments, is following up with that.
Right. Plus, too, then you have the swallow study, too.
And the swallow study.
Yeah. Okay, Bob, I would love for you to just briefly just tell me what your expectations were of having a baby, because this is your first baby.
Yes.
And, what were your expectations? And then just tell us a little bit about what happened after she was born and you started getting some diagnosis from the doctor. How that may have changed.
Okay. So we were very much looking forward to with Ryan, and it was a long process for us to get to the position of having Ryan.
Mm-hmm.
So everything was great. We were looking forward to a new member of our family, and then when in the hospital there was a few precursors of when she was born. One being an ear tag, and then a failed hearing test, and then another failed hearing test, which was very definitive in the hospital. So we realized at that point there was also a little paresis on her mouth where she couldn't latch on to feed. So with that, things started to kind of spiral in a different direction than just the joy of having the baby. Now we're concerned about Ryan's health and whatnot. So from that aspect, things started to culminate, in the hospital and then leaving the hospital, where it looked like she had a greater issue than just feeding and the ear tag, and that's where we started down the process that's ended up with a charge syndrome diagnosis.
And how did that affect you?
Greatly. I think it knocks you off your feet in the
Right.
hospital. Just hearing the thing that she couldn't hear.
Right.
We had no idea what else was coming.
Right.
So me personally I was distraught.
Right.
Just concerned. More of Ryan's has no control over that and realizing what her future could be like. So
Right.
you kind of take all that emotion on and you think of the future, you think of everything very
Right.
quickly, and it was devastating.
Right, and you probably didn't know anyone that had a hearing loss, or probably, unless they're
I
elderly.
didn't even think of it in that
Yeah.
context,
So
to
you
be
didn't
honest
have
with
any,
you.
right?
I didn't think of it or even try to correlate or think of anything else. All I could think of it was my baby.
Right, right. So you didn't have any frame of reference what that really meant?
Nope.
Over the long period?
I did not.
Yeah. And so, when the doctor started giving you those diagnoses, and like each one, did you feel differently when each one came? Did you feel more, how did you feel? I mean, did you just feel like, what else,
So after we left the hospital, we engaged with our pediatrician, and there was other things that we had to come about.
Right.
Our pediatrician, who was pretty active and early on, thought charge could be it. So we did a lot of research, and we just had to see more specialists. So realizing how big the picture was, for me personally, a lot of the devastation happened in the hospital, and I think recognizing let's move forward, just our job is to take care of Ryan. She doesn't know any different. So each diagnosis is tough to swallow, but the original onset of just Ryan having health problems is how I originally dealt with
Right.
it. And from that going forward, and even today, no matter what's going forward, is she's our baby, we're going to take care of her. So, how do you take an unforeseeable outcome and just make it positive?
Right.
And with that being said, it's always a challenge.
Right. Now, did you get on the computer and start looking through the
Yes.
internet?
Immediately.
And what happened with that?
Just looking through things.
Yeah.
You type it all in, you have all this data out there. So the research and looking into things, I think, prepares you for what the doctors are going to say.
Okay, so that made you feel more prepared versus then scaring you more?
I think it realized that there could have been a lot of different outcomes
Right.
from the different diagnoses. And me personally, I kind of prepare for the worst and hope for the best.
Right.
So, I don't know. It's a very fluid
Right.
environment still, right?
Right.
We have another test tomorrow, Wednesday,
Right.
with the GI. And
Right.
we don't know. So, once again, I guess for me personally, I prepare for the worst and hope for the best. And that's just kind of the way I go about it.
So then, how do you see Ryan now today, now that you've sort of worked through some of it? I mean, obviously the future's still very dicey, you don't know where it goes, but do you feel like she's making progress? You feel like she's...
Yeah, I think
more-
I have a nephew with Down syndrome, and talking to my aunt then, everything you hear is always doom and gloom, or the worst case, or you hear it from the doctor's perspective, which is extremely one way, and you feel that it's extremely it's hard. So talking to her and just saying you hear the worst, up front, and it always gets better. And that's been pretty true with her. I mean, we heard she had hearing, sight, all these things, and you have no idea the level of it. And here, we feel she's doing fantastic. So she's making great strides every day. You can notice the strides. I personally don't really view her as having charge. I just view her as Ryan, and we're going to enable her to do whatever she can.
Right, right. Very good. And if you were to, I guess you talked about how it changed you. How did it change you, though, as a person? Has it changed you much as a person? Or?
I don't know. I think so. Yeah, I mean, it slowed me down, right? I think I've always, somewhat, my wife may disagree, but I think it slowed me down to a point where, you're usually always running off to the next thing, and going to the next thing is really not that important.
Yeah.
So I think it's given me a greater perspective.
Right, right. If you were to give one piece of advice to someone who's going out there for the first time trying to help a family in your situation, what would you want her to possess or to be like or to do or whatever? What's the best thing that someone new coming into your home can help you with?
Well, I would think yourself and Sherry have done a great job, and I think one of those things that it is, I think there's empathy, there's understanding, and there's explanation, right? Mm-hmm. So you don't need to know everything. It's more of empathizing with the situation we're in, which with experience, so yourself and Sherry are very good. Mm-hmm. So I think you've had a lot of experience with developing those talents, which are not easy to develop. So I think the idea is be empathetic to, which you have to have that characteristic in that job. Mm-hmm. So empathetic to the environment. It's not a and then trying to understand the family situation and then help guide that family as best you can, to the desired outcomes. Mm-hmm. So I don't know if that answered your question. But.
Yeah, it did. I mean, it really is important that, a parent advisor at least sees where you're at and can help a parent to move to the next level. A lot of parents, they want to hurry up and fix it, but we can't hurry up. We got to wait until she develops. So we're giving things at the same time she's developing. So then we're giving one step ahead, and then you can see the progression. I think that's the one thing that Ryan's definitely showed me as a parent advisor is that this is the next level, and if you give her the right stimulus and you work with her, she meets that. I mean, she's just showing such typical behaviors that it's so much fun working with her.
And I leave that to my wife. She's here more than
I don't know.
So it's more, I mean, she
but you both, I have to say both of you all.
Right.
I mean, it is a joint.
You're very involved.
I was going to say, you are definitely a joint.
Yeah.
He did not say that has changed him. It's the quintessential daddy's little girl relationship. I mean.
No, she's the apple of my eye.
Yeah, I couldn't tell.
He does things that most fathers would not do. I mean, he's definitely attentive to her, really every need. And if he could do what I do, he would. He really would. But I'm just mom. I'm just a little different. So.
I mean, that's so true. I mean, you're right. A lot of, in several families that I have worked with over the years, it's like they take different roles, but you both share the role, and that's nice to see that, you have like this is her role versus your role. No, you both share the role, which is really nice. Obviously, you're home more often because you're here with her and he's working, but when he comes home, I definitely see him immediately going to her.
Equal. Right.
Yeah.
Equal.
I mean, definitely. So there. And I think that's really important. It's tough being a parent advisor for the first time. Both Hannah and I can tell you that from being first-time parent advisor, that you're like a deer in headlights, and you're trying to do your best, but you just don't know what the outcome. You don't know what you're walking into in a home.
I can imagine.
Not knowing what.
Have no idea what the skill levels that for the parent.
Right.
Or the child, I have to see where the parents' levels are versus the child's levels and see where they're matching and how I can sort of make things work together. But that's been that's my big challenge, because every family's different. Kids can be similar, but they're not identical. So that's the thing too, is that, what matches this child may not match the next child, even though they're similar in very different ways, So, but that's the hard thing, and just sort of finding out what's the next developmental step for her. And if you, put it out there, she reaches it, which is so much fun to watch. I mean, she's really, really trying to be.
Yeah, I mean, like this week with the hearing aids was, she never looked, because her right ear is much worse than her left ear. Mm-hmm. And she's never turned her head to the right. But now when you carry her and you talk, and she turns to the right, which never happened previously, because she just wasn't
getting that information.
She didn't sense it as much, right?
Plus, too, when they did, right before they aided her, she had fluid.
Oh, yeah.
And that fluid was also impacting her hearing. So with that on top of it, and then once you release the fluid and you get that all cleared out, and now you put hearing aids on, now we should be getting definitely, I mean, she was giving some responses, but we had to be right at her.
Right.
your level to get those responses. And now I can definitely see how she's doing well. Mikey, can you tell us, how it's been since Ryan came home?
It's interesting. She likes colors a lot.
What's it like
She
having a
excessively
baby?
stares at him. I think she just thinks they're interesting.
Mm-hmm.
And I don't think she has a favorite, other than like all of them.
Yeah.
Other than that, and
But-
she likes to look herself in the mirror.
So what do you think about having a little sister now?
Well, this is my first experience with a sister. I have 2 other siblings in Michigan, but she's easier to take care of. Trust me. My little sister, with this giant Lego thing, it was on the table. She picks it up and chucks it across the room.
Oh.
My little brother, he needs to take a chill pill. Like he's running around the house like a monkey on steroids.
Yeah. And Ryan,
Ryan, hopefully she isn't gonna be like them.
right? What do you see Ryan doing in the future?
Let me see. Maybe she might be an artist since she likes colors so much.
Mm-hmm.
I don't know.
Yeah. And does Ryan look at you a lot?
Yeah.
I think when I saw her earlier today, she was following you around the room. Do you play with Ryan?
Yeah.
Do you like playing with her?
Mhm.
I think she does too.